when you're working, try to experiment and make like for yourself, like experimenting while you're working, so you can learn and you can keep finding what's going to help your patients. As I said, he came in with a left knee pain, but he has a stretch mark on both. And when I treated this, I used some kind of oil anyway for the massaging or for the neuromuscular technique I'm doing now to minimize the friction and the heat and the pain as well. So I use the neem oil. We're going to help the skin as well. And I noticed that the stretch mark is better when I treat it here. And what is the concept about that each spinal segment give nervous supply to a piece of skin, dermatome, to a motor nerve to a muscle, and autonomic to a viscera, and all the four variables affect each other. If you fix one of them, you're going to fix the other. You can refer to other videos. I tried to put the link here. I'm going to do the picture of the stretch mark before and after, but now I'm looking for muscle knots. I looked here with a knee joint pain. One of the concepts of the scholars, if you have a joint pain, try to search for muscle knot and the muscles near the joint. So when I searched it here in the calf muscle, this calf muscle was really big and huge, and after I worked in a muscle knot in here, it was tender and painful, so I would do some release. Then the size of the calf decreased significantly by the eyesight. We didn't measure it by the eyesight. Hopefully you can measure and see. You can experiment and measure yourself too with your patients. And here also I'm going to go on a hamstring, and I found some muscle knots in here. I'm going to release those muscle knots as well. Hopefully this is going to affect the knee pain. I'm going to follow up next visit after he coming back, because he came in with knee pain while running, and after the treatment he reported that no pain with running, but only pain in the knee comes after running. So we're going to try to find the muscle knots. I'm trying to as Leon Cheto in his book Soft Tissue Manipulation, that you should release the muscle tightness first before you strengthen the muscle. We're going to work on releasing the muscle knots and releasing the hamstrings and the calf muscle, because this can affect the passive insufficiency for the knee extension. Then after that, we're going to work on strengthening the quadriceps and extensors as well. Best around, leave your comments below, and looking forward to continue with you together. Bye now.